The trick with pelvic organ prolapse is that many people go to their doctor when they realize that they have it. And unless it's a surgical concern, the doctors say there's nothing you need to do now, you can wait. But in actuality, there's a lot you can do now to both protect yourself from it getting worse and also set yourself up for success in the event that you do need surgery. In today's video, we're going to talk specifically about what pelvic organ prolapse is, what are the risk factors, what are preventative measures that we can take, and how pelvic floor physical therapy can help you navigate this difficult situation. What is pelvic organ prolapse? This is when the lining of the vaginal walls starts to thin and the bladder, the uterus, the urethra, the rectum, or our gastrointestinal tract can start coming into the vagina. There's 4 different stages of pelvic organ prolapse. Stage 1 is when there's a slight protrusion into the vagina, whereas as the numbers increase to 2 to 3, there's more protrusion into the vagina coming to the opening of the vagina, and stage 4 is when any of the organs that I mentioned start to come out of the opening of the vagina. Women with pelvic organ prolapse can experience varying degrees of bother. So a number of studies show that women with prolapse have absolutely no symptoms, and other studies show that women with even minor prolapses have very bothersome symptoms. It really depends on the type of prolapse, the degree of severity, and how it's actually impacting someone's life, which is going to depend on if somebody's a sedentary, non-sexually active person or somebody who's very active, both in the gym and with sexual activity. All of these things can be managed, but there's more solutions than just surgery. What bothers me the most is that women are told there's nothing you need to do when there's a lot you can actually do. There are many risk factors for pelvic organ prolapse, including chronic constipation and straining with bowel movements, rapid weight gain, previous pelvic surgeries, but the most important being vaginal deliveries and birth of a large baby. The reason that these are risk factors is because all of the things I just mentioned will actually contribute to weakening or causing a fragility of the connective tissue of the vaginal wall, which basically then allows for what is effectively a herniation of the organs into the vaginal cavity. Now, the connective tissue provides support to all the organs that we have talked about, but also so does the pelvic floor. So if the connective tissue is compromised for any of the reasons that we just discussed, the pelvic floor muscles can actually have an opportunity to make up for the difference in the laxity of the connective tissue, which is why it's so important for people that are at risk of developing prolapse or who already have a prolapse to have an optimal pelvic floor that works with the rest of their core. So if you're at risk for developing pelvic organ prolapse or you already have it, one of the most important things to consider is how do you move forward and not make things worse, and what can you do to protect yourself? So starting with postpartum women, this is the most common situation where your body just went under a tremendous amount of stress and you're likely to have a postpartum pelvic organ prolapse. Or maybe you don't right now, but then you're likely to develop one. So one of the most important things that postpartum women can do is go to pelvic floor physical therapy after the birth of their baby, anytime within the first year, to really optimize their pelvic floor muscle function and make sure that their muscles of the pelvic floor and girdle and core are all working together well to counteract the negative effects that the pushing and straining has had on the connective tissue, which is what leads people into developing prolapse. So a lot of the things that a pelvic floor physical therapist is going to do is to help identify what impairments somebody has and tell the person what they can do at home to help themselves, as well as what maybe needs to be supported by a medical professional. So examples of this can include identifying the impairments. Some people have tight pelvic floor muscles, some people have weak pelvic floor muscles, some people can't move their muscles at all. We need to figure out what this particular person has as an impairment, and then what we can do about it in terms of therapeutic exercise and things in the clinic. Some women have pelvic organ prolapse in the immediate postpartum period, whereas others may develop it slowly over time. It can start to affect women in their 30s and 40s, and the same thing applies that I just said. No matter when it starts or develops, a pelvic floor physical therapist can help you identify what impairments can be optimized to help reduce the risk of the pelvic organ prolapse getting worse, or helping you prepare for surgery in the event that you're going to need it. Another thing that's important to keep in mind is that when you do a pelvic organ prolapse surgery and there is a repair, there is a chance that it can happen again. And in order to prevent that from happening again, all women considering surgery and all women that have had surgery should again go to the pelvic floor physical therapist to optimize what they can control, which is the pelvic floor muscles, the pelvic girdle muscles, and their core. This will help to mitigate the effects and the laxity that's in the connective tissue that leads into pelvic organ prolapse. If you think you're at risk for developing pelvic organ prolapse, or if you've already been diagnosed, give us a call. We're here to help. Please leave your comments in the section below, and also don't forget to subscribe to our YouTube channel.